Good afternoon, everyone. Thanks for joining us today. We're really excited to bring you this training. And there is an attachment in the handout section of your dashboard. Please take a couple of moments before we get started to download and save that if you would like. It is the PowerPoint to this training today. And I'm very excited that we have two wonderful presenters today. We have Dependency Case Manager Zharia Lennear. Yay! Oh. Welcome. And we also have our beloved Megan Brown, our Child Advocate Manager, also presenting. Welcome, Megan. Okay. And they're going to introduce themselves in a moment. We're just going to give you all an opportunity to go ahead and download. Oh, I see something in the chat box already. Someone saying yay. So to both of you. Okay, wonderful. And so all of you know, I did go ahead and create a spin the wheel. So at the end of the training, I included the names of everyone who submitted a pre-registration question for our presenters. And that will be for the gift card giveaway at the end of this training. And also there is a short survey at the end of the training. If you would please fill that out, just giving your feedback about today's presentation, as well as topics for future trainings. We'd love to have your input. All right. I see a hand raised, so let me just attend to that one moment before we get started with our content. I see some hands raised. Okay. If you have a question, please submit it in the chat box. I don't have the ability to unmute you for verbal questions. I will be monitoring the question box, the chat box. So use either one that you have on your dashboard. All right. Getting our PowerPoint ready here. Okay, so Zharia, would you love to start?
Yes.
Okay.
So, hi everybody. My name is Zharia Lennear, and I am a dependency care manager with Family Allies. I've been a DCM for going on 3.5 years. This is actually my first job in child welfare, but previously I worked at a daycare as well as an assistant in housing in my college. I did obtain my bachelor's in social work from the University of West Florida, which is in Pensacola, in 2016. I chose social work because I wanted to help the children and families in my community. I honestly, truly do love my job so much, and I enjoy going to work and doing my job every single day. I have good days and bad days, but I have mostly good days, and I wouldn't trade my job for anything. I enjoy working in dependency because I get to interact with a whole multitude of people from a whole bunch of various agencies, and my knowledge about child welfare continues to grow each and every day. I would say every week I learn something new. I'm super excited to be here, although I'm a little bit nervous, but I'm happy to be here as a presenter to share with all of you my knowledge and tips about guardian ad litem's and DCM's working well together.
Okay, I guess it's my turn. I'm Megan Brown. I've been a CAM with the Guardian Ad Litem program for a little over a year now. Prior to becoming a CAM, I was a dependency case manager with Family Allies. I started that in September of 2017. Similar to Zharia, when I was a case manager, that was my first career in child welfare. My degree is actually a bachelor's of applied science in biomedical sciences, but social work has always been a very big passion for me. As soon as I had the opportunity to go into child welfare, I jumped in as quickly as I could. And I think the Guardian Ad Litem program really called to me because my passion really lies with advocating for the children in their best interest. And with the Guardian Ad Litem program, I'm able to do that more easily.
Okay, so I guess I'll start with this one. So regarding the roles of the child welfare professionals, we have dependency case managers, which I am, and essentially the dependency case manager manages the case. The title is, I guess, pretty self-explanatory. We all do a host of things regarding the case in itself, but our main point is to help the children and families that we work with. In most of our cases, it is reunification, so we manage the case and help our parents work towards reunification or whatever other permanency goal the child has. We do things from making referrals, doing reports for courts, transporting children, supervising visitations, a host of things. A DCM wears several hats. Also, in our company, we have family support workers, and they really do support the family in lots of ways, whether that be their main role is usually to transport and supervise for our parents that have supervised visitations, but they also transport to and from doctor's appointments, school appointments, anything. And our FSW team is great because at the drop of a dime, they're ready to help as much as they can with our children and families. They also do work with the guardian ad litem sometimes, because when we have our FSWs supervising visitations, they're the ones who will know the ins and outs of visitations when they occur, the parents' behavior during visitations, the kids' behavior, and they are also a vital role in working with the GAL program.
So then we have CAMs, which would be what my role is. We support our volunteers. We're working our own cases right now, and we do a whole slew of other things as well. And then we have the guardian ad litem volunteers who really do the majority of the footwork on the case. You guys are the eyes and ears for the guardian ad litem program, and you guys are the children's best advocate. And then roles that we have that aren't necessarily on this slide are some of the CBC. So we have the wraparound team who facilitates family team conferences. We have health services coordinators who help with the referrals. And there are a lot of other players within the child welfare system that don't necessarily get seen, but they're players in the game.
And I would completely agree with that. But just some examples of what case managers do. We do have court mandated responsibilities. So for our cases, because our cases have goals, whether they be permanency goals, whether they be reunification, adoption, permanent guardianship, and we do have court mandated responsibilities that we have to do that we don't, at least for myself, I don't think of it as something I have to do, which is essentially part of my job that I do anyways. But we also do have to make sure that we are doing them as they are court mandated responsibilities. One of the big things we have is we make referrals for our case plan tasks. For our parents that have a reunification goal or parents who want services, we essentially are the link between the parent and the provider. So when we have a parent who has a case plan, we do referrals in our system Mindshare, and then that referral is assigned to a provider. That provider, usually what I do is if I am already aware of the provider from working with them previously, I provide that information to the parent. And I tell them, hey, you can jump the gun and reach out to them yourself. Tell them, hey, my caseworker sent over a referral. I would like to get in with as soon as possible. If the parent doesn't reach out, the provider, once they get assigned that referral, they will make efforts to reach out to that parent. On that one, regarding when you talk about how to get information regarding the parents' providers, you can reach out to the DCM, you can reach out to the guardian ad litem if they should know, as they should know, because both sides should be having ongoing communication. If you're familiar with the provider, reach out to them, whether you're a DCM or a GAL, because since they're the one giving the parent that service, they can tell you the ins and outs of attendance, how they're doing in the program, if they're learning anything. One of our big things also is to communicate with parents. I believe we're court mandated at least once every 14 days, but realistically, we should be having an ongoing conversation with our parents. I know most of my parents, we talk ongoingly regarding providers, visitation, how they're doing, just an informal version of me going over their case plan with them. We also do attend court. I really wish we were going to court in person now, but with the pandemic going on, we all know that we're doing it virtually, which is interesting, but we do attend court for judicial review hearings, permanency hearings. We have motion hearings and a lot of the court hearings that both the DCM and the guardian ad litem program attend. We also speak with caregivers. So For DCMs, we're required to see all of our kids at least once every 30 days. But I know that within this county, we have done the once every 25 days. So it gives us a little bit of leeway if we have issues with scheduling that home visit. But I mean, at our home visits, we talk to the caregivers, GALs. Most of mine, they have ongoing contact with the caregivers, and it's that kind of two-way street of both sides interacting with the caregivers. Because I mean, if the kids are out of home, the caregivers are the ones caring for the children, and they know the ins and outs of the children. If the parents visit with them, they can give you insight on that. We also talk to GAL. I can say I need to talk to some of my GALs more consistently, but I think I have a good relationship with all of them, and I feel like all of them, well, I hope they know that they can reach out to me whenever. We do email, text, phone call, and just maintain our ongoing communication, because just as vital as DCMs are, both GALs and their CAMs are vital to the case overall. Something that we also do is we write judicial review, social summary reports for our courts, and those reports are, we have a progress update, which is essentially, it's an updated overview of the parents, the children, and other people in the household. And then we couple that with our judicial review, which is essentially rating the parents' case plan compliance. We rate it, we go over visitation, how the kids are doing, recommendations to the court, education, and we submit that report to the court. That way the court and all the other parties are aware of what our assessment of the parents' household is and our assessment of the children is. We also document in FISPIN. We're supposed to document any and everything. FISPIN is essentially, I think it's our Optima, where we put everything into our program, and that's what we live by essentially, is FISPIN. So like education, medical, dental, anything regarding the case is going to be in FISPIN. And I believe GALs may have access to see what's in FISPIN.
So the CAMs have access to FISPIN, but the volunteers do not. But if anything, if we needed information, I know personally that when I'm looking over people's JRs, I'm double checking progress updates and stuff like that to make sure that we have all of the up-to-date information, because things may have changed or they may be having difficulties conversing with the case manager. So I always double check that as I'm reviewing reports.
And I also find it helps to, because we have access to Becca, and I also find it helps to look at the GAL JRs when I'm working on mine, just to see if they have any, if I haven't already spoken to them, to see if they have any recommendations or any concerns that they put in their report. That way, when we get to court, we're not all like, someone's not blindsided by someone's recommendation as to visitation and placement. So we do have the FSWs, our family support workers, which I briefly explained earlier, but their big thing that they do is they supervise family time visitations. So whether that be with mom, dad, grandma, whoever, what we do as DCMs is we send a request over to our family time team. We have two separate teams, and they each have a number of family support workers on their team. And they try, any request that we send, they always try to find someone who can help us out and essentially support us and the family, as their title explains. They do write visitation reports. If there's concerns regarding the visitation that they do, they can write a report that is filed with the court, and the court will take that into consideration, whether that be making it a no contact or modifying that parent visitation. And a big tip, and it's what I would say, if you have a parent who is visiting, if you contact the DCM or even the CAM, they can hopefully point you to the correct family support worker. Even if you don't know the person, I'm guaranteed a DCM that you know might know someone who has their number, or a CAM that you might know might have their number. So you can always reach out to someone and be like, hey, I have this case and I'm wondering who does visits, and the FSW can tell you probably more information about how the parents interact with the children during visitation than I can. They do transport our children near, far. Most of them are in the county, but like we have FSWs who transport them to and from therapy, because either the caregiver or the DCM can't transport the kids to visitation. We have FSWs who, when the kids are still in their regular school, like their host school, and they haven't changed yet, we have amazing FSWs who transport the children back and forth to school. And which really does help out the family and the DCM, because we have FSWs who transport kids across county each and every day to ensure those children get to school. And they also do communicate with the GALs. Like I said before, they are a good point to reach out to regarding how the parents and child interact, since they are the ones there quote unquote weekly regarding whatever the parent's schedule is, they're probably the best point of contact regarding if the parents confirm, if they attend, if they're late, if they bring supplies for the children, because that also goes into that parent's ability to safely care for their child. They can tell you if the parents are under the influence. Our FSWs also do drug screens from our parents, so that's another key component that they do that helps us out greatly, because our parents typically probably only expect us to drug screen them. They wouldn't think they'd be drug screened at visitation, but our great FSWs do help us out with that, which helps us a lot regarding the parents' progress in their case plan.
And I do want to point out that although we do have family support workers to do these things, they are not always assigned to cases. There is a long waiting list for visits. So if there is no family support worker assigned, the case manager is responsible for all of this. So on top of their own tasks, they have to do these tasks as well if there's no family support worker available. Also, it looks like you were asked to explain what BECA is. So just to go back, BECA is the Brevard clerk's way of being able to access court reports. There is a section where you can find public information. However, dependency cases are always private. That's another thing where the CAMs have access, but our volunteers do not. So if we're ever missing a court order, or if you needed to go back and look at court minutes to figure out maybe what the next court date is, or if you didn't remember to write down if the goal changed, that we could go into BECA really quick and look at those documents if they're not already in Optima.
And Florida is also very liberal with the amount of things you can see regarding public records. So I know we have a host of parents who arrest records, anything on that. Florida is very liberal, and you're able to see the date they were arrested, and it goes back to, I would say, I've at least looked at records from like the 1980s that I've been able to see in BECA. You'll be able to see their charges, the arrest date. You'll be able to see the arrest affidavits. I know we have parents who sometimes get arrested and they're evading us. You can look in BECA and see where their last known address was, where they were arrested at, who they were with, if anybody else is involved. And you don't need a login or anything for that. That is all public record, and it's a big help.
And we were asked if it's helpful to put FSW contact info in Optima. So it would be, I think we would have to reach out to upper management to figure out where we would be putting that into Optima, because in my head it would make sense to do associated parties, but I don't know if they would have to add the different FSWs into the caseworker section or how we would do that. But that's definitely something that we can work with upper management to get, so that we can be putting that information into Optima so that you have it readily available, just like you would if a case manager was assigned. Okay, so the child advocate manager's role is to bridge the gap between volunteers and case management. So a lot of times I will tell my volunteers to CC me on emails. That way I can keep track of if the case manager is responding, if they are responding and they include me on the reply, what the reply was, just so that I can help keep track of the back and forth, and so that if there's a question that the volunteer may not know the answer to, I can help. We explain the advocacy process to our volunteers. So we explain the court hearings, we explain pretty much everything, how we think visits should go, what we should see in your notes. We help with your reports, community resource experts. So we know a lot of the providers, we know how the referral system works. We know, at least most of us have a good amount of knowledge about what providers take what time and what providers do what, so that we can start guiding our volunteers into advocating. So let's say we have a child who needs a behavioral analyst. I could recommend, okay, well, first of all, have you reached out to the case manager? Has a referral been put in? And then we can start looking into providers to see if it's been assigned a provider. If not, we can try recommending one to the case manager. We're child welfare experts. We collaborate on court reports. As you know, you send us your reports, we look it over. We may do edits. or we may do suggestions, and then we'll send it back to you, and then we get it filed. We track our court dates. We do that through Optima and through going to court dates ourselves and writing down the next date. Optima documentation, I always tell my volunteers, document everything you do. So every attempt, everything, and then we approve your notes. Sometimes we testify in court. We help do staffings. I know I try to attend all staffings for every case that I'm assigned to, whether there's a volunteer or not. That way I can not only support you, but I can know what's going on in the case. And most of all, we just support volunteers. I'm always here to be an open ear for mine. I know all of the other CAMs are as well. And we are here to lift you up and give you whatever you need. Okay, we're ready for the next slide. And then we have our guardian ad litems. So as you guys know, you're a vital party to the case. You are committed to your child. Oftentimes, a child may go through 3 or 4 case managers. They may go through different providers, but at the end of the day, typically, the guardian ad litem is the one constant in this child's life. You guys do make referrals, and your CAMs will help you get that, or you make referrals to friends of children and families that may get, or that should get approved to help get children clothes, or maybe they're doing extracurriculars, and things like that. You guys are finding your own facts for the child. You're talking to the child. You're finding out what they want to happen in their case. You find out their needs and if they need any services. You gather information from important parties such as the caregiver. We're supposed to be talking to the parents, the case manager, the FSW. We're allowed to go to the schools. We're allowed to get medical information. You guys do court reports and you attend hearings. Sometimes you have to testify in court. Optima documentation, like I said before, document everything that you do, even if it's just an attempted contact, get credit for your work. And that way the guardian ad litem program as a whole sees what we're doing for our cases and knows how much time we're putting in. And you guys make recommendations to the court. So we can recommend permanency goal changes. We can recommend changes in placement, changes in visitation, and all of that stuff that we work with our team, including our attorneys, to figure out the best way to go about them.
And regarding the documentation, not only for a DCM, but also for guardian ad litem, it's very important because for some of our cases, we'll get to the point where we're in TPR, at the TPR mode, and the parent's like, I've never heard from the guardian ad litem or the caseworker. I've never had any referrals. No one's ever called me. And if both the DCM and the GAL have documented properly, then we have that evidence of us reaching out to that parent and trying to help them to back us up in court. And that would be extremely vital when it comes to the TPR trial. Okay, so I guess Megan will talk about this one.
First contact with the DCM. This can be done in different ways. If you decide that you would like for your CAM to send an introductory email, just be like, hey Zharia, just wanted to let you know that this person took the case. Here's their email address and their phone number. You can always ask what their preferred method of communication is. I know as a DCM, I didn't want to be on the phone for an hour talking to somebody. If you can send me an email hitting all of the points that you need, or even a text hitting all of the points that you need, that would be best for me. All DCMs are different. Some do like phone calls because they're quicker and you can address everything quicker. I know personally emails and texts were always easier to copy and paste into FISFIN or into Optima. You can communicate the best times for you guys to get together and talk to each other, because your case manager may be busy from 5 to 7 every day because that's when they usually do their home visits. So you don't want to call them between 5 and 7 because you're likely not going to get a hold of them, or you're going to be waiting. And you can also establish how frequently we would like to be talking to each other. I know Zharia and I both discussed this, and we think that at least monthly would be best. That way you guys can exchange information you're getting at home visits. And if you have concerns, you guys can go back and forth and talk about it.
I agree. And just to piggyback off of Megan, for introductions, most of the time you guys have a volunteer or at least a CAM assigned before we do. Because for our cases, after we have the shelter, the case gets staffed over from DCF to case management. And usually by the time we have our first home visit, either you guys have already reached out to them or they just know they've been appointed. So normally what I do is I ask my caregivers in the first home visit, have you heard from the guardian ad litem? Most of them don't even really know what that is. They just know it's someone who has reached out to them and they know it's someone else involved in this case. And then for most of my cases, I think I've been around enough to know who all the CAMs are. So if a volunteer hasn't been assigned yet, and if I know the CAM, I'll reach out to them on my own. I'll let the caregiver know my experience with the CAM. I've never had an issue with a CAM on any of my cases. Just to segue that to make the caregivers feel more better, because some of them are like, I don't know who this person is. They just called me and said they need to come out to see the child every so often. So I try to explain in layman's terms to them what a guardian ad litem is. And I just tell them that it's someone else that we work with who's involved in the case, and that they represent the child's best interest, and that both myself and the GAL will be seeing the child monthly. Like I said before, I know we have to do visits every 25 to 30 days. I believe you guys go out monthly. So at least if we maintain the ongoing monthly contact, both of us are seeing the kids monthly. So we should have at least, if anything is the same, then that's okay. But if there's new information, both of us should have been able to meet with the family and obtain that info, and then touch bases at some period during the month. I know, like Megan said, different DCMs operate differently. I have a couple that prefer email. I know I have GALs, a couple that prefer email, a couple prefer texting, some of them prefer to talk. For me, I'm very open, and I feel like that helps out. But I mean, whatever way of communication the GAL prefers, I try to accommodate that, because if the GAL prefers email, I don't want to be that person who's like, oh, I only take phone calls, because I feel like we should be working together. Definitely get the best times to communicate right off the bat from them. Like Megan said, some of them might have evening home visits. I know for me personally, 8 to 5, you can reach me. If I'm busy, I'll call you back and let you know. But some people have different schedules than I do. In exchanging the contact info, I would say when you first reach out to the DCM, just a quick like, hey, what's the best way for me to reach you? Because like I said before, you don't want to have a situation where you have a GAL who prefers email and you have phone calls and you don't respond to emails and they feel like you're ignoring them and whatnot. But it's just a lack of communication that could be solved with a simple conversation. And the frequency of the contact, like Megan and I both said, I would say once a month minimum. I know that I myself need to get better at maintaining that monthly communication with my GALs, because when you do that, it avoids you guys getting to court and then the GAL has something to say, the DCM has something to say, there are concerns brought up, and that initial conversation hasn't been had to where, or the ongoing contact hasn't been had to where this stuff could have been solved beforehand.
So if you haven't had an introduction with one of your case managers yet, go ahead and reach out to them. Or like I said, if you don't feel comfortable, reach out to your CAM and ask them to do that warm handover, so that the case management is getting an email from someone they know introducing you, and then you guys can start that open line of communication. This is definitely vital, like Zharia said. That way you have contact information, best way to reach them, best times, everything.
And another point I would say is something that I do when I do get a new case, I often reach out to the CAMs that I know to kind of get a feel for the other person and see if they have worked with them before, which is what you guys can do too. If you guys already are working with a DCM, guaranteed if they don't know the DCM well, they at least know who the DCM is, and they can hopefully point you in the direction of them. So if you're really working well with a DCM, you're like, hey, I got a new case, they should be able to at least point you in the direction of the new caseworker that you're going to be working with.
So ongoing communication.
So this is something that, oh, do you want to go?
So you can go.
So this is something that both Megan and I have talked about that we feel is probably one of the most key issues on both sides that we both feel like could lead to solving a lot of problems or issues between the guardian ad litem and the DCM. Because ongoing communication is important, because when you have that ongoing communication, it kind of, I think for all of us, it shows that respect that both sides care enough to reach out to the other side and have the ongoing communication about the case. That way both of you guys are on the same front as we are on most occasions. That way you guys can have that working relationship, because at least I think all of the CAMs that I've worked with, we have a pretty good relationship, so I can call them up, hey, is there a volunteer on this case? Hey, what's going on with this? Any issues with that? And they can do the same to me. And it's really big on collaboration, because I mean, essentially, we are in this together in this dependency process. So the ongoing collaboration really helps out with the cases, because when we're on a divided front, it doesn't present very well to the caregivers, the parents, or anybody else. So when we work together ongoingly for the children and the families, it shows that we are all in this together and that we are working towards hopefully like a unified goal together, whatever that permanency goal is for the child. I personally have not had any issues with any of my CAMs or volunteers, but I know that that the communication is built on trust. So if you have if both parties are working together and really open to talking about the good things, the bad things going on with the case and whatnot, it will really help build their relationship, because I can guarantee you, unless the GAL or DCM leaves, you're going to have another case with that GAL volunteer and that CAM. And then if you guys don't already have that relationship built in your other cases, it's not going to carry on. So it's great if you have previous cases with that CAM or that volunteer, because you guys already have a good relationship. You guys already know how each other works and each other's like vibe, and you'll be able to carry that on. And your caregivers and parents will also be able to see that in your interactions with them. And please be on both, this goes for both sides, please be respectful of each other's times. For me, my phone is usually on all the time, but some DCMs are like, don't call me at this time, whether I'm doing home visits or not. You guys may have some volunteers or camps who are like, I'm off on Fridays, or I don't answer the phone before 9 o'clock in the morning. So please be respectful of their time, because you don't want to call someone at a time you know they're not readily available. Or if a volunteer is a teacher or something, I mean, they are volunteers, they do have other lives to lead. So if you know that like that person's busy at this certain time, don't reach out to them knowing you're not going to get a response. And then vice versa, if the GAL is aware that you have something going on, like a court hearing or something, then we would hope that both sides would be really respectful of each other's time, and definitely be empathetic to mutual concerns. Like I said before, we're all in this together. So if I have concerns about the case, or if you have concerns about the case, both sides should be really open and understanding of how the other side feels. It shouldn't be like, oh, you're attacking me, or you're sided with the family, or you're sided with a child, or you're sided with the parents. We are both working in this together. And something that we forgot to mention when we're talking about referrals is Mindshare. So Mindshare is our system that we do our referrals in. So you guys don't have access to Mindshare, but it's like I guess it's our Optima for referrals. So we do our referrals in Mindshare, and then that's where we can see our ongoing progress for our parents, whether that be them not showing up, if they attended sessions, if they didn't. We're supposed to get like ongoing provider notes that they can either be uploaded into Mindshare, or they can be sent to us. So Mindshare is a key, I would say it's our key website that we have for accessing referrals. Because we have parents who will go to court and say, I never had a referral, no one called me, I wasn't told about this. And Mindshare, you can see when you submitted the referral, you can see the date it was accepted, you can see the date it was assigned, you can see when the parents went out. Our providers are very good at documenting their efforts to contact that parent, which will be very handy when we get to hearings where the parent debates that, because we have that proof right there. And it'll especially help when we get to TPR trial mode, because our parents will be like, I never heard it from anybody, I was never told. And we could be like, well, this Mindshare note here says the provider, for example, Yellow Umbrella, tried to reach out to you 7 times on October, November, December, and you never responded back to them. So Mindshare, like I said, is essentially our referral hub for case management.
And I know that some people submitted questions beforehand, and there was a lot of questions about how to keep this relationship going and what happens if we have differing opinions. It's okay to have differing opinions, but ongoing communication will really help with that. So if you have ongoing communication, you guys can talk openly about your opinions and why it's different or why you feel the way you do. And the case manager may have information as to why that's not a concern for them, or the GAL may have information as to why it's definitely a concern, and the case manager needs to look into it more. We are sometimes getting two different sides to the story. I know personally, Zharia and I have a case together. The child called me for one thing, turned around and called Zharia saying that I said something completely different. So we were able to get together, and I was like, this is what she told me, and she's like, this is what she told me, and we were able to get one solid picture of what's happening. So
Yes.
ongoing communication is extremely important. And coming from both sides as a DCM and as a CAM, don't burn the bridge. I know as a guardian ad litem, you can get frustrated because you feel like things aren't going fast enough. I don't feel like there's always a super great understanding of processes, especially adoptions, with the ARC committee and everything. Do your best. If you're thinking something, say it to your CAM before saying it to the case manager, because I know as a case manager, there were things said to me that just completely ruined my day because I'm busting my behind trying to get everything done, and I'm being told that I'm not doing my job. So just try to be courteous of that and how much they have to do, and and then same with DCMs. DCMs need to realize that volunteers are doing what they need to be doing. And I know sometimes going to schools can be seen as stepping on toes or reaching out to medical providers. And I think case management doesn't realize that GALs are also independent fact finders. So we're not just getting our information from the DCM and from the kids. We need to be doing our own fact finding, because if it does come down to TPR, if we want to close the permanent guardianship and there is an objection from the parents or from either side, we need to be able to prove our point.
And just to piggyback off Megan regarding contacting other people, like I personally have no issue, because that helps me out if you contact the school, the doctor, the therapist, that way. And then if you can get to them quicker than I can, so be it. But like she said, you can't trust parents, you can't trust the kids, because like Megan said, they'll tell you one thing and tell somebody else something else, and then neither one of us can go off with that, because if we did, we would be in a whole lot of mess. But yes, like she said, while we have to keep in mind that the GAL, they do have things to do, so does the DCM, which goes back to the ongoing communication. So for me, if you call me and I don't respond, and I try to be really good about responding, so I would say 24 hours is like a decent amount of time if you haven't heard back from me. And then if you don't, just reach out to me again, because more than likely I probably just read the message or read the email and forgot to respond. I don't have any issue with being essentially harassed if I haven't responded. I know for some other caseworkers, they do get upset when the GALs reach out to the schools and whatnot, because like Megan said, they feel like they're stepping on toes. But I mean, like, I would just explain to that DCM that, hey, I'm just trying to help, and we're just trying to help out the case. And if I want to reach out to the school, I'm going to do it, not in like a rude way, but just kind of explain it of like this involves a child, so I feel like I should have access to these records also. I won't personally be upset about it, but that I would just approach it openly with whatever DCM they're working with.
So it looks like somebody asked, do CAMs have access to Mindshare? The answer to that is no, we do not. That's one of the few things that we don't have access to. We do have the case manager, or if worse comes to worse, we can always reach out to the health services coordinator, which is another player in the child welfare game that is part of the CBC and isn't always necessarily recognized, but they help assign referrals, and they can look into Mindshare and easily tell you, okay, this has been done, here's what's going on, and all of that information.
And I see another question, are Mindshare / therapy notes shared with the court or GALs? So in most cases, we can access them, but we are able to print those Mindshare notes, therapy notes, and file them with the court. That way all parties are aware. Mostly what I do is if I read it in Mindshare, I'll just email, text, or call that GAL and let them know of the status of the parent's case plan progress. But they are Mindshare notes, psychological evaluations, assessments, progress reports. They should all be printed out ongoingly and filed with the court. Information sharing. So this is something that comes from both sides, whether it be from GAL to DCM or DCM to GAL. Did you guys find out things on home visits and from the school and from other people that we might not have found yet? On the other side, we get information from parents, caregivers, other relatives that we can share with you guys. Regarding the referral for services, that will come on, the referrals will come from our end, but it greatly helps me if you guys are at a home visit and you have some concerns about behavior and you let me know, or if you put in a report, hey, I think this child would benefit from play therapy, individual counseling, or even just call me up, hey, the caregiver says this, are we able to do a referral for this service for the parent or the child? And then it's the DCM's responsibility to put in those referrals for the parents and the children.
And again, information sharing is an easy way to, if we do have differing opinions, explain why. If each side has all of the information that the other side has, then I feel like things won't go to the extreme. We also, like Zharia said, we need to be confirming what parents and children are saying with the DCM, because I know I've had cases where the child will tell me one thing and then they're not telling the DCM because they feel like the DCM would be disappointed in them, or they just don't quite feel as comfortable with the DCM. So if we share that information, like the child's having trouble in school, that could help us get them a tutor or figure out what we need to be doing to better help these children.
And then depending on the child in the case, you might have some children who are way more comfortable with the DCM than they are with the GAL. You might have kids on their 4th or 5th DCM who, like Megan said before, the GAL has been the only constant in their life. So if we have that ongoing information sharing and the kid's like, hey, Miss Megan, I'm sorry, I'm not doing good in school, but please don't tell anybody, the GAL can communicate that to the DCM so we can both work together to get whatever services we need for the children. And also with parents, because you have parents who, for any reason, they might not want to talk to the DCM right now, but they're having issues with housing, or they're having issues, something that we both may be able to help out with. So if that GAL is in contact with that parent, then the GAL can make it known to the DCM, so the DCM and the GAL can work together to address the issues, because we're essentially, which we keep repeating, we are all in this together, and the ongoing communication really, like Megan said, is extremely, extremely important because it can solve a host of issues, concerns, or anything, and it's just better overall for the case if we are on the same front and if we have the ongoing communication. Because I've seen court hearings where everything from the DCM's perspective, everything is good, and then the GAL is like, I've seen multiple home visits where the kid is acted out, they need therapy, and the DCM put on the spot, although the DCM wasn't made aware of these issues. So if we have the ongoing communication, we don't have to all be sitting in front of the judge and the judge is looking at us like, why was nothing done about this? And we're like, sorry, Your Honor, this is the first that we're hearing about it. If we have that ongoing communication and we're not on a divided front, we'll be able to get all the perspectives, because like Megan said, something that may be an issue to the GAL may not be an issue to the DCM. But if we have that ongoing communication, it should be able to be talked about openly and freely. And then if either side is worried about how the other person is going to take whatever contact they have or whatever criticism or whatever opinion they have, I would, if you're not comfortable with reaching out to them, like Megan said, reach out to your CAM, and they can help you, like she said, cross that bridge and mend that relationship or approach it however you guys think it's best, to help us overall, especially when it comes to things like permanency. Because so when all of our kids get taken, well, sheltered from their parents, they all have a permanency goal. That goal could be reunification, adoption, permanent guardianship, or another planned and permanent living arrangement. So if we have if the DCM is working towards reunification and the GAL is opposed to it, we should have that open, ongoing conversation as to why the GAL is opposed to it, because you guys are all very competent and very able. So I feel like if you guys have concerns, they should be validated and heard and taken into consideration when moving forward on this case. And maybe, hey, maybe reunification isn't the most appropriate thing. But if we have the ongoing communication, it could be talked about with all parties to discuss why or why not we should be moving forward to reunification. So we're not all sitting in front of the judge, a JR, arguing about why we don't think reunification is appropriate if we have issues that have not been brought to the light of the DCM or the GAL.
Joint home visits are, well, they can be a miracle. So there are several different reasons for joint home visits. One could be just because you guys wanted to go together. You wanted to see how home visits are going on two different point of views. It could be because you don't feel safe going to the home alone. It could be because you've experienced issues with the caregiver or the child where you're having one conversation, but it's being portrayed as a completely different situation. Or it could be simply because you're having trouble getting a hold of the caregiver. They're not getting back to you, whatever. Reach out to your DCM and be like, hey, do you mind if I come do a visit with you? And then I've never had somebody just blatantly tell me no. It does help with the role explanation, the DCM versus the GAL, because you're both together. And then it helps because, like Zharia said previously, a lot of the caregivers and the children are just like another person to come talk to.
Yes,
to put on my schedule.
And it does help really like bridge the gap. I know that like for Megan's volunteers, I know that we have some shared cases where the volunteers, like, I reached out and called and texted, and I'm like, okay, let me shoot a quick text over to her and say, hey, the GAL is trying to get a hold of you. I had another case where the father was not responding to the GAL at all, but I had no issues with communication, so I reached out to the father and said, hey, the GAL is trying to get a hold of you. Please call her today. The home visit, he answered the phone call shortly after that, and the home visit was able to be set up. But just piggybacking off of what Megan said, like the reasons to want to do a joint home visit, at least for me, you don't have to have a reason. If you want to go out with me to see what I do, so be it. I may want to be like, let me see what you do during the home visit. And like Megan said, you can and will get different answers from, if you don't do home visits jointly, you'll get different answers from the caregivers, the parents, the kids. The kids will tell you one thing, like we talked about before, and they'll tell the GAL another thing. And when you guys go out there together, it gives the opportunity to see how the caregivers and the child respond to both of you guys there together, because you have some cases where they think they can play the system and they can get something out of Megan and something out of me, and then I don't understand what their point is, but when we're out there together, it kind of reconciles everything. Any disagreements that we may be having, any issues that we may be having can be addressed at that joint home visit. That way the GAL and the DCM are there to see the children, the family, and like I said, address any issues that either party may have. I know at least for the cases that I have, like I said before, some of them don't really understand what a GAL is. So I try to explain it, but I can only explain what it is so much. So when we do our joint home visits, it kind of gives me a chance to explain my role and the GAL a chance to explain their role. And it allows the kids, the caregivers, and the parents to understand the similarities and the differences between all of us. Because I have some parents who are like, I don't know what that program is. I know they just stand up in court and they say stuff I didn't agree with. But when you do joint home visits, it gives a chance for us to explain and answer any questions that we have about our role, whether that be a DCM or a GAL. And it does help out a lot.
It looks like somebody asked if I think it's a good idea for GALs to do joint and solo visits. And the answer is absolutely yes. If you've never done a visit with a DCM, the information that they are supposed to gather is very helpful. I still base my own personal notes off of what I would be looking for as a DCM. And of course, it's always good to do solo visits. You get to do your own information finding. As we said previously, the kid may be more comfortable with you and may be more likely to open up to you than they would the DCM. So it's good to have that private interaction with the child. And if they're more comfortable with the DCM than with you, you have that individual time to build that bond with the child. So I definitely think doing a mix of both is good if possible.
And then the way I would approach that is I would just reach out to the DCM and say, hey, do you have a home visit planned soon? Do you mind if I tag along? You may have some DCMs who might reach out to you guys and say, do you mind if I tag along to your home visit, because some of our caregivers, they kind of get overwhelmed with the separate visits. So if we can kill two birds with one stone and the caregiver is okay with it, I don't have any issue doing a home visit. I'm very open to being like, okay, yeah, I plan to go out there Thursday at 6:30. If you want to meet me there, that's okay. Usually I like to tell them to, like, if we can meet a couple minutes before, talk about any issues they might have, any questions I might have, anything I'm looking for specifically at the home visit. And then I find it's really helpful when we do a joint home visit together with the family. And we can do joint home visits with the children. If you want to go with the DCM to meet a parent, if you want to be there for a drug screen, at least for myself, and I feel like for the rest of the DCMs, we are very open to you guys being on joint visits for any type of outside, any field work that we have involving the family and children, and especially visitations. If you have any issue with coming to a visitation, I would reach out to your CAM, the DCM, and see if you guys could work through those issues, because there should be no reason that you guys aren't welcomed or made aware of, or you shouldn't be told that you are not able to come to a visitation.
Mhm.
Okay, so these are some staffings that we have. Usually they're brought up by case management, but it is all of these meetings listed involve the Guardian Litem Program. So first up, we have the Family Team Conference. So I was trying to think earlier of the best way to explain this, because I haven't had very many of them. But I would say a Family Team Conference is a planned meeting that's led by the wraparound team, where we come together, and usually we come together for an issue. So the ones I've had, they're for housing. We've had some for behavioral issues. We've had some for placement issues. And we come together. Usually what happens is the invite is sent by the wrap team. Everyone involved with the family team, or that the family thinks should be appropriate, is welcome to come. So the key players that we have are the family themselves, any support that they think is positive. The guardian ad litem can come, the volunteer can come, DCM should be there. The DCM supervisor usually comes if they think it's appropriate for them to come. In some instances, you might only need the DCM. And essentially, it's a meeting where we talk about the issues that the family's having, and it's very strength-based. So we talk about the issues the family's having, the way that we can solve those issues, the family needs, the way we can meet those needs, any barriers to meet the needs, and they all have, each need that we have like a timeline on when we can meet those tasks. And FTCs are held ongoingly. So typically each person is given like a small task, whether that be, so the issue is housing, the task might be for that parent to go on Craigslist before the next FTC to look up housing. It might be to complete an ECHRS application for housing. And when we come back at the next FTC, ideally each person will have done their task, and we can update it and see and look at our progress towards meeting that whole family goal. For example, I had an FTC where the caregiver was being evicted and she needed housing that was appropriate for herself and the child. Over a couple of FTCs, we were able to get some grant money for the caregiver. She was able to move into a 2-bedroom home in Rockledge, and she was able to, we were able to get her housing, which was the main issue that we were having, because we ended up closing our case permanent guardianship. So a standing team conference, I would say it's a more impromptu meeting that can be scheduled on late notice to address any issues, but still FTC, STC, all guardian items and CAM should be invited to those meetings. Because obviously if we have an issue with the family, you guys are key vital roles in this dependency process. It should be invited to any of these meetings, so that whether that be the DCM, someone should be sending you guys the invites to these. And if you have an issue where repeatedly you're not getting invited, reach out to your CAM, reach out to that DCM. If you don't get any response, reach out to their supervisor and say, hey, I'm not trying to make an issue of it, but we've had STCs and FTCs and I've not been invited. And that issue should be corrected. And if it's not, I would just say, keep pressing the issue, because there should be no reason why you guys aren't invited to family team conferences or standing team conferences. And I see we have a question. I don't have good visibility of DCM staffings for my cases. Either I find out after it's happened or a few minutes before. How can this notification be improved? So I would say that goes back to the ongoing communication with the DCM. So for most of mine, because usually we get ample notice of any FTCs, STCs, permanent staffings, we do get ample notice. So I would say reach out to the DCM. If you don't get a response, reach out to that DCM supervisor, because like I said before, you guys should have notice and you guys should be invited to all of these meetings. If you have FTCs and STCs that you're not invited to, I would say if you don't reach out, if you don't hear from that DCMS, reach out to your CAM or reach out to other DCMs and say, hey, can I please get some help because I've had meetings that I haven't been invited to. That way we can hopefully find the root of the ongoing issue so it doesn't occur moving forward. So permanency staffings are staffings that we have that are held to discuss the permanency of the children. So recently we began doing them at the 3-month mark, which definitely helps because we get a quick gauge of if mom or dad are doing anything, where this case is going. And in that instance, the people who attend are the facilitator, the caregivers, parents should be invited, AAL, GAL, the CAM, and the attorneys from CLS, GAL, and are on the line for the hearing, if they're able to. And in those staffings, we just discuss the parents' progress, how the kids are doing, any behavioral concerns, and we kind of figure out, we kind of staff to see where this case is going permanency-wise. So most of them, you request them to, and I believe that GALs can request permanent staffing be held. Correct me if I'm wrong. Okay, if they need to be held, because permanent staffing, we have them periodically, but if there's ever a time where someone on a team feels like it should be held because either the parent's not doing anything or we need a goal change or something, they can be held as needed. And like I said, we all sit and discuss the permanency goals, how the parents doing on their case plan visitation, and we discuss if we need to recommend a goal change at the next hearing. We discuss if we need to keep the same goal. We discuss if we need to reunify because we think mom's ready. And what happens is whatever recommendation we have from that meeting, I know for DCMs, we include that in our report and our recommendation to the court for our subsequent hearing. So if we're 9 months down the road and mom and dad have done nothing, we might need to permanently staff it to discuss if we're going to go the adoption route or the permanent guardianship route, which is very important that the caregivers and you guys are on the line, because if DCM and GAL are thinking, oh, we're going adoption, and caregivers like, whoa, I don't want to do adoption, it's not my thing. That's also a good chance for us to talk with the caregivers about permanency. And I mean, sometimes we have instances where if that caregiver can't provide permanency, we have to think about other options for that child when it comes to long-term permanency for them. But you guys, we get ample notice of them, so you guys, and I believe it's someone that you actually be able to reach out to someone who can tell you when the next thing is. They are held in Central on like a certain day of each month, and they're held in our South Care Center on a certain day of each month. I believe you can also reach out to Allison Garceau she's a child welfare specialist, and she is the facilitator for these meetings. So don't hesitate to reach out to a DCM who may know her, or reach out to her yourself and say, hey, can you let me know if this will be staffed permanency? And she adds to the calendar. She sends out the invites. It is an issue if you are not being invited to these, so please let your CAM know or the DCM know if you guys are not being invited to these, as you should be, because you guys are a vital part of the permanency of the children.
So for permanency staffing specifically, the CAMs do get a list of what cases are being staffed for each day, because they're every Wednesday and they switch off between South and Central. So if you're not being invited, it's either because the CAM didn't see it on the schedule, which is a communication issue, or your CAM may have forgotten, which happens. We all have a lot going on, but for permanency staffing specifically, we do have a way of knowing when they're happening for sure. Sometimes they do get canceled, and I don't know about the DCMs, but the GAL specifically are not being told. I'm not completely sure what to do about that, other than keeping open communication with your DCM. Hopefully they would be able to shoot you a quick text or something and say, hey, just letting you know this was canceled for whatever reason. For FTCs and STCs specifically, your information should be put in during the referral process. So this is a situation, again, where ongoing communication would definitely help with the DCM. So they have your contact information, they have your name, they're putting everything in like they should be. This is another situation where if we're getting invited, we don't always get told that it's being canceled. That's not always on the case manager. I know as a case manager, I've had it happen, and the wraparound team had to cancel, and they sent the cancellation to me. I didn't think anything of it, and then I had an upset volunteer calling me. They're like, nobody told me it was canceled, and I was like, oh my goodness, I'm so sorry, because in my mind, if they sent it to me, they sent it to you too.
Yeah.
So that's something that maybe we can work between agencies to try to figure out and get better at, but it's definitely an understandable problem that has been happening since I was in case management.
I agree, and there should never be an intentional not telling you guys when meetings are canceled, because that's an issue, and that's an issue that should not be occurring. Whether or not, if the relationship is bad, the caseworker should still have, if the caseworker is aware, they should still have the decency to reach out to that CAM or GAL and say, hey, just letting you know this is canceled. That way you guys don't waste your time jumping on conference calls or waste your time jumping on meetings that are not being held. And if it is an ongoing issue, definitely reach out to your CAM and let them know. That way it can be addressed moving forward.
Critical junctures. So relationship building is obviously a critical juncture. You want to have a good relationship with all parties of the case, even with the parents. I know as GALs we are child focused, but we still do want to have an open line of communication with the parents. That way, if anything, we can reach out to them and be like, hey, what's going on with your case plan? And then we can go back with the DCM and converse as to what they're saying the barriers are and what the barriers may actually be. Family engagement, that goes along with what I was just saying. Placement issues and disruption. Somebody had asked if there is any protocol for letting guardians know about this, and unfortunately there's not an official one in place. I know for things like runaways or any critical incidents, it's on the critical incident form that they should be informing the GAL. I know we're still not always getting informed. So for those things specifically, they're supposed to be letting us know. Realistically, we should be informed about placement issues and disruptions as well, and about children moving. Unfortunately, we're not always informed until either it's already happened or we're trying to go to a home visit and we're being informed that the child has already moved. So I think, once again, this is a situation where ongoing communication would be very helpful. Yeah, Zharia.
Okay, so just to piggyback off of Megan, so family engagement, like Megan said, although you guys are for the child, family engagement is something that can help out the whole case move forward overall. And if you need the parent's address, phone number, the DCM should be that point of contact and should be able to give you that information. If you have any issues with that, please reach out to your CAM, who can maybe reach out to the DCM, because if the DCM has a phone number for that parent or an address, they should have no issue providing you with that. It should not give you any issue when you ask for it, because there's nothing to be an issue out of it. Placement issues, what I like to do is the first time we have a slight issue that could be a placement issue, I like to tell my GAL. That way we're not to the point, like Megan said, of we think we're doing a home visit and that caregiver was like, oh, he got moved yesterday, I couldn't do it anymore. Because when we have placement issues, there are staff things that go along with that you guys should be included on. Because we have placement issues, and for example, in foster care, I have a case now where I have 2 placements that have submitted 30-day notice, and we have these meetings that we have. They're called PSS meetings. I'm not sure what that stands for currently, but GAL is on the line for those phone calls to discuss the placement issues and see what we can do to better support the placement and the children. And you guys are included on that because, like Megan and I said before, you guys might be aware of behaviors that we might not be aware of. So if we're on that phone call with the caregiver and the caregiver was like, oh, they choked the dog, the GAL could be like, oh, I've noticed some behaviors like this also. That way we can address them going forward. Family time observations, this goes back to, if an FSW is doing them, this goes back to that, and they are the best point of contact for that. You can reach out to your DCM or another DCM to get those information. Something we can also do is, since we have our 2 family time teams, I believe maybe Dina can have their info maybe sent out. That way, if you guys can't reach the DCM or the FSW, you can reach out to their supervisors who can provide you an update on that, on how the visit's going, because the FSWs do communicate how the visits go to their supervisor. And the family time observations are very important when it comes to things like JRs, when it comes to things like permanency staffings, goal changes, because if you have a parent who isn't visiting or isn't consistent, or if you have a parent who is visiting and making an effort, that impacts their ability, that impacts their success in their case plan. And you should also take the family time observations into consideration when making recommendations, as we do, because at least on our judicial reviews, there's a section specifically where we talk about how the visitations go, the quality, the consistency of it, and that is taken into consideration by the court when we talk about moving forward. Because if we have parents who aren't visiting, don't call, don't text, that really goes to reflect on how their willingness to care about getting their child back, their willingness to engage in seeing their child. Because I mean, you and I would think visitation, if I get my kid taken, I want to see that child day in and day out every time I can. But we have some parents who don't visit at all, and then they get in court and say, oh, I didn't have a chance, no one told me, I didn't know where to go. And that also goes back to documentation, because hey, if you're aware of visitation and that parent's like, oh, I didn't know where to be, if you're like, oh, well, if you know and you communicate with that parent, I'd be like, hey, just letting you know, are you aware that your visitation is set for Saturday 10 to 2 here? Because you'll have instances where that parent would be like, no one ever told me anything. I didn't know that I could call them. I didn't know that I could come see them at visitation. I didn't have a ride there. And these are also things that parents may tell you about. And if it's communicated to us, hey, mom wants to visit but doesn't have a bus pass, that can be communicated to us so we can work it out to help that family. Goal changes. So permanency staffing is usually the prime time where we come together to discuss goals and we talk about goal changes. And then court is usually the formal place where, whether that be the Guardian Litem Program or the DCMS and CLS can recommend a formal goal change to the court. I've had instances where the judge is like, I'm not changing the goal. I've had instances where we don't recommend a goal change, GAL program does, the judge changes the goal. I've had instances where we both agree on the goal change and the judge is like, okay, we're going to change the goal. So court hearings are very, 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 very important. We are doing them remotely now, but even on the remote hearings, I've only had a couple instances where the GAL has like a recommendation or they say something that's not true, and then we're all sitting in front of the judge kind of debating this, that, and the third, which in my opinion should not be occurring, because if we have that ongoing communication, all of the ins and outs of the case should have been ironed out before we get in front of the judge. The court hearings are a prime time for things to be asked for, but luckily what I've seen happen is where like the GAL asks for like, oh, a goal change, it's already been discussed at permanency staffing and we're okay with the goal change. We do sometimes have the issues where we recommend no change. The GAL program recommends a goal change, which like we spoke about before, hopefully that would have been discussed about earlier. And if we can't come to the same agreement, hopefully that ongoing communication could help us discuss why we disagree and discuss the pros and cons of each thing. And I mean, at the end of the day, if we don't agree on a goal for the child, which hopefully we should, because I feel like all of our cases, we should be on the same front for the children and the family, because I feel like what's in the best interest of the child should also be what's best for us from a case management standpoint. But we do have instances where we don't all agree. Like we keep saying, the ongoing communication will definitely help out with any disagreements, any issues that we have, so we're not in front of the judge and the judge is asking both sides, okay, well, why wasn't this done? Why didn't you guys do this? Why are we changing the goal? Because in my opinion, that's not really the time or the place to be having those discussions, because if we could have had it ongoingly, we could have been on the same front when it came to being in front of the judge, because court hearings are very, very important and are very, very professional environments where we should not have all the back and forth of this, that, and third. We should have the back and forth about visitation with parents. Another thing that I might bring up is our parents say anything on the court hearing. Something I had to learn the hard way is if a parent says something that's not true, I would just don't say anything. I don't speak out of turn. Don't be like, oh, that's not true, that's a lie, I've reached out to you. I would just wait until the court properly allows you to respond to what that parent's saying. If we're at JR and the parent's like, oh, this wasn't done, the referral wasn't done, usually both sets of attorneys already know the info. They can respond appropriately to the judge. But if there's a time where a parent says, oh, I never met you, they haven't reached out to me, I would just make a side note of it, like a mental note of it, and then if given the opportunity, I would speak to it. But if the judge doesn't address it, I normally don't, because parents say all sorts of things, and if nothing's ever done with what they say, I just kind of let it go in one area out the other if it's not true.
Appropriate boundaries. So I think a big thing with Guardian ad litem specifically is that we are not advocates for the caregivers. We are advocates for the children. Caregivers can be very overwhelming. They can give you all of the information, and they're like, I don't know why this, and this isn't happening, and I need this, and this. And if it's having to do with the children in their best interest, it's okay. But once again, we are not advocates for caregivers at all, or we are there for the children. And if what the caregiver's concerns coincide with what's best for the children, we can work on it, but we're not there to make them happy. Please do not promise things to children or to parents.
Because they will remember and they will bring it up later.
When kids ask me, when am I going to go home, or when is this going to happen, the answer I give them is, I don't feel comfortable answering that because anything could happen.
Yes.
The ultimate decision is neither up to me nor case management. It's up to the judge. She just takes our recommendations in consideration. We could walk in and especially with Judge Crawford, he could be feeling some type of way one day and he's going to order something completely opposite of what we're recommending. So please don't promise any outcomes or anything like that.
And then sorry.
Okay, go ahead.
I can guarantee you, if you do, that parent and that child are going to throw it back up in your face at court. They're going to throw it back in your face at home visits. Like the case Megan and I talked about, that child has asked repeatedly when she's going to go home, and we both reiterated to her that we give our opinion to the judge. We can only write reports based on what we see and how we feel and our assessments, but the judge is going to do what she thinks is best. But I will tell you, if we're in court and the judge doesn't order what that caregiver or what that parent wants, they will blame us. They will come back on us and say, you didn't speak up, you didn't tell her this, you didn't tell her that, why was nothing done, when am I going to get my kid back? And you just have to keep reiterating to them that we can only do so much, we can only write reports and file reports and stuff, but the judge is going to take all that into consideration and make her informed opinion on what she wants to do. But when you promise children things, they will remember. Like if you tell them, oh, you're going to go home soon, every home visit is going to be, when am I going to go home, when am I going to go home? That case might turn into a TPR case. Because you never know, like Megan said, you never know what's going to be ordered. You can go in there and expecting one thing and come out with a completely different order. And we'll just have to take that and move forward with it as it goes in regards to the case.
Children do have the right to attend court hearings, especially children, I would say the age 12 and above. If they say that they want to attend court hearings, typically I would say, if it's an advisory or an arraignment, not necessarily super important that they be there because that has nothing to do with them immediately. I always try to make sure that if a child's of age and they want to come to a JR, that they're present. So that if that means me talking to the case manager and saying, hey, this kid wants to go, can we get her a link, or can we set up with the caregivers? Or if I can, I'll just set up with the caregivers myself. The child does have the ability to talk to the judge in private. It's a little bit difficult right now because we're doing things via Microsoft Teams, but especially when we're in person, she'll pull them back into her chambers and talk to them. So that could be very empowering for the child. And then just remember, confidentiality is very important. We should not, if you have companion cases and one caregiver is asking about a different case, don't talk to them about that case. Just explain that we are bound by confidentiality and that unfortunately we can't discuss that case with them because they're not a party to it. Same thing with family members who aren't a caregiver or anything like that. You really need to be careful with what information you're giving to certain people.
And then just to not reiterate, but the older children, some of them want to know every single detail of their parents' case plan, their parents' case plan compliance. And I would just say, whether that be a DCM or a GAL, I have just told my kids there are certain things that the kids I'm involved with can know, and there are certain things that are for grown-ups only. The younger kids might want to know info too, but I just tell them it's grown-up talk. It's not anything that a child should be dealing with. Megan and I have a kid now who wants the ins and outs of her mother's case plan. And we just kind of told her it's not appropriate for us to be discussing with her because while she is a child involved in the case, it is her mother's case plan. And there's just certain things regarding the case that the children should not be knowing. If they ask you, I would just tell them that, like I said, certain things just shouldn't be discussed with them since they are kids. And I would tell them any information they need to know, that myself and the GAL are more than welcome and open to telling them information they need to know, because it is their case. They are involved in it. But certain things, even if they're 16, 17, you still are a child and you only have limited involvement in this case. I'm not going to tell you your mom's drug screen results. I'm not going to tell you if she did the eval. I'm not going to tell you the results of it. I will tell you the things that I think are appropriate for you to be knowing as a child involved in this case.
And if you're uncertain, like it says, reach out for support. You can reach out to your CAM and ask, hey, this person's asking these questions. Is it appropriate to answer them? Or you can reach out to the DCM and say, hey, this person's asking. I don't want to give him the information that you haven't given. Obviously, we're not keeping secrets, but we want to be careful with what information we give to.
And then do that before you tell a child something. You have to come back and be like, oh, sorry, that was wrong. Because that child's going to be like, you're a liar. I don't trust you. And then I have no issue. If you don't know, you don't know. If that kid's like, oh, what's going on? I would just, if you don't know the answer to a question, tell that child and caregiver, I don't know. Because if you tell them something and it's not true, they will hold that over your head, and they'll bring it up whenever they feel a chance to prove how you're dishonest, you're not truthful, you told them one thing and did another, you told them that you were unified, then here we are filing TPR. So just if you don't know an answer to a question, just be open and transparent and say, I'm not sure, but I will reach out for an answer to that and get back to you. So both of us, both sets, whether that be the DCM, the DCMS, the GAL volunteer, or the CAM, we all are doing a host of things. I know the volunteers, most of them have jobs they deal with. I know the CAMs have a host of children they have to deal with. DCMs have a whole caseload of ins and outs of things to do, and the DCM supervisors have lots of things to do. All of us are being pulled in many different directions, whether that be school, doctor, therapy, home visits, caregivers, JRs, home visit notes, doing other things, just like you guys have reports and other things to do. So I know we talked before about communication. 2 business days is a really appropriate amount of time for both sides to give the other a chance to respond. If after 2 days you don't get a email, I like to do a, hey, just following up on this. And if they've forgotten, that usually triggers them to see whatever email you sent in the beginning or get back to you. And I've never had an issue with it. If it's been more than 2 days, usually I'm like, hey, circling back to this, but I've never had anyone, I don't think, deliberately ignore me to the point where I need a response and I don't get a response at all. I know that for us, I know that I had my supervisor as needed. So like if I have an issue where the GAL, we have an issue with, the CAM has an issue, I have no issue adding my supervisor if it's an issue I feel like I can't handle alone, or if I feel like I need that extra support from my DCM, whether that be to solicit a response from whatever party I'm talking to, or whether that be that way my supervisor can be aware of the issues that we're having, which is vice versa for you guys. I don't feel some type of way when I see CAMs on emails, because I don't blame you. If I was emailing too, I'd also CC my supervisor on it. That way they're aware. And I feel like some people may think of it as like a tattletale thing, but please don't feel like you can't add your CAM on the email. Just like I feel like I can always add my DCM on it if I think it's appropriate.
I've had a volunteer who was going back and forth with a DCM and email, and you can't read people's like what they're trying to say in email and text. It can be lost in translation. Something may come off as snarky when really they're just being genuine. So I've had volunteers be like, hey, this email seems kind of iffy. Can you like feel it out for me? And I'm more than happy to read it. Or if I'm already on it and I'm reading it, I'll more than happy to try to interpret at least what I'm getting out of it. Because like I said, you can't read like how a person's saying something through an email.
And you'll have instances where people try to do that, and then people's feelings are hurt. They may take the email some type of way, and then you guys are back in a scenario where whether that be the DCM or the GAL, they're upset about what was said in the email. So like Megan said, just don't take that with a grain of salt, how someone responds to you in an email.
So we're going to touch on the permanency goals. As Zharia said before, there are 4 different permanency goals. I think there's 3. The 3 main ones are in this slide. So reunification is pretty self-explanatory. It's when the parent is able to do what they need to do. There's a behavior change, yes, and they're able to get their kids back. Yes. So obviously we always, typically the first goal is reunification unless there was some kind of egregious abuse.
Yes.
Conditions for return is something that DCMs and the Guardian Ad Litem program should be looking for to assess whether or not a child can be reunified. We cannot make recommendations if we are not seeing visits. I would say at least see a visit every 2 or 3 months, if not more if possible. And talk to the parents. It helps. Parents may be able to tell you barriers, and then you can go to the case management and figure out where we need to help. I know sometimes case managers, you see them doing things and you're like, why are you doing this? Case managers have to make reasonable efforts for reunification, even if the parents aren't doing what they need to do.
Yes. So we will, so like Megan just said, so we have parents who don't visit, don't do anything, and then I'm like, oh, I did a referral for a parenting assessment, and the GA might be like, why they're not doing anything on their case plan. That is done not only because it's part of our job requirement, but when we get to the TPR trial, if we file that, the parents are going to be like, I was never given the opportunity to engage in services. I was never told about Yellow Umbrella. I was never told about Aspire. I was never offered visitation. And all that, those reasonable efforts that we have made come into play when the judge decides whether or not to TPR that parent. Like Megan said, most of the time our goal is reunification unless we have, unless the allegations are so egregious in nature to where reunification is not what's best for the child. And those instances are like extreme neglect, extreme physical abuse, sexual abuse, because and then TPR is something that's taken lightly because it takes a lot for the judge to find that terminating that child's rights is in the child's best interest. So if that point is reached in the beginning, it's called expedited termination of parental rights, which is where whatever abuse, abandonment, or neglect allegations were so egregious, that's what's best for the child. Or we have it to where if the parent doesn't do their case plan and we're 2 years down the road, we might file a termination of parental rights petition due to the parents not making the behavioral change and doing their services. What's like Megan explained before, it's a combination of behavioral change and the services. So we have parents who do the services, but no behavioral changes. So we have parents who have behavioral changes, or we may think, but they're not doing the services. It's twofold. You can't have one without the other, because if you don't, it's not going to work out for the child, and that child's going to be at risk of further harm and neglected for that parent. And Megan did mention conditions for return. So conditions for return is what has to change in that parent's household in order for us to recommend that the child go home. So for case management, on each of our progress updates, we have 5 boxes that are yes or no. If any one of those boxes is a no, that child cannot be returned to that parent's care. It is not until the parent has reached all 5 yeses that we can start having the appropriate staffings to where that child can be returned to their care. We have parents who are like, I don't know what I have to do to get my kid back. I don't know what I have to do. I've done my classes. Because I would say a lot of them, I don't think they read our reports that we write. They just kind of come into court and they're like, I don't know what to do. But what we've done now is our conditions for return clearly explains what has to change in that parent's household in order for us to recommend that the child go home. So it's not only, it's the changed behaviors that are evident as evidenced by their progress in their case plan task. So you can have a parent who did their psychological and counseling, but they're still with that perpetrator of whatever violence you have, and then you don't have the behavioral change and the service plan, so you're kind of stuck in this thing where you can't recommend that child go home until you have the behavioral changes and the completion of their case plans. Because I have, for example, a parent now who the children came in for physical abuse and household violence and failure to protect. The mother is doing her case plan task, but she is still with the father, and the father's not doing anything on his. GL and I, we have a good working relationship. We talk ongoingly about the kids, and we're both on the same forefront that the kids should not be returned to the mother's care until she shows the couple behavioral changes with her service plans, with her case plan. Because obviously, if you're actively participating in your case plan, those behavioral changes should accompany that. And if you don't, then we have an issue, and we have to seek other permanency options for that child if you're just not getting it and not progressing as you should.
And there is a comprehensive training on conditions for return in the online training academy. If you are wondering, I definitely think that's a training that everyone should be taking at this point, because conditions of return are really the epitome of reunification at this point. They don't do reunification home studies anymore. They do conditions for return packets.
And then just to add on that, if if our next JR is 6 months out, but that parent has met conditions for return, we can always staff it for conditions for return before we're back in front of the judge. Because if that parent has met conditions for return, and I'm going to say CFR because it's what I'm so used to saying, if the parent has met CFR and the JR is 4 months out, we can start having the appropriate staffing to reunify that kid before court comes up, because if the parent has met CFR, there's no sense in us keeping the child out of home until we're back in front of the judge again, if that parent has shown that pattern of being able to provide the child with a safe environment that's the opposite of what the child was removed from. So we do not have to get in front of the judge regarding that, and for other things. So like if we have issues of visitation, and you think we need to make them go supervise, the CLS attorney, the GAL attorney, they can both file motions to get the case set before the judge to address whatever issues we have regarding visitation. I've had cases where the parent acts inappropriate and we file a motion to make it no contact. I've had motions filed where there's unsupervised and they go supervised, because if there's concerns, whether they be from myself, the GAL program, and our current court order does not, what's the word I'm looking for, is not appropriate, then one of the attorneys can file a motion to have the judge consider making that change that's needed. And most of the time it's if the parent acts out and the child's safety is in jeopardy, or even if we're working towards reunification and the parent has an arrest or something drastic, we can always petition the court for various motions that need to be addressed so the judge can make the necessary changes regarding the dependency case.
And then we have permanent guardianship. So permanent guardianship is, I would say it's probably the second to last choice for permanency above another planned living arrangement. So permanent guardianship is when reunification and adoption are both not in the child's best interests. Permanent guardianship is typically for children who are older, because the court retains jurisdiction over the child. The parents can get their act together and then petition the court to reopen the case so that they can be reunified with their child later down the road. Permanent guardianship is done with a relative or other adult with strong commitment to care for the child. Visits are still in order or still happening. If we close the PG, it's usually monthly instead of weekly, and then typically the caregivers have the ability to determine when the parents can begin doing unsupervised and stuff like that.
And then sometimes we have caregivers who they want to adopt, but they don't understand that either we won't win the trial, or they don't really understand the difference between adoption and permanent guardianship. And some of them don't want to do permanent guardianship because that parent has that chance to reopen it. And they have to, hopefully both of us can explain to whatever case we're dealing with why we think the goal of permanent guardianship is appropriate. Some people are like gung-ho and no, I'm not doing adoption. And a lot of them don't want to do it because they don't want to cut that parent out completely. Mostly for our parents who have substance abuse issues, they want to still give that parent the opportunity to somewhere down the road get their life together and hopefully get their kid back. A lot of the permanent guardianship ones, they want to keep the child because they realize that the child cannot return to that environment, but they still want that child to maintain that connection with that parent. And some of them, yeah, and then like the slide says, permanent guardianship, the child is usually really bonded with that parent, but reunification nor adoption is what's appropriate. The visitation, like Megan said, it usually is 1 time a month minimum, but it'll be at that caregiver's discretion. So if that caregiver wants to offer that parent weekly visits, assuming the parent is doing okay, then that caregiver has that discretion to do that. I've only ever seen it once where I closed the case permanent guardianship. The mother went to rehab and she petitioned the court recently to reopen her case, and her case is reopened for reunification. In that case, the caregiver, she was kind of confused. She thought that she got permanent guardianship, but I kind of explained to her again that it was permanent guardianship with the understanding that the mother could have the chance to reopen her case. And sometimes when the parent petitions the court to reopen it, the court does not reopen the case because that parent they have to show a proof of completing that previous case plan for the court to even consider reopening their case. So if you have a parent who's like, no behavioral changes, no case plan compliance, they're like, I want to reopen the case, the court's not going to be inclined to reopen it. That parent will have to show proof of completing their previous case plan and show that it's in the child's best interest to reopen the case. Because ultimately, if we can get reunification, that's what we would like. Because if we can get that child returned to their parents' care eventually, if it's safe for them, then that's the route that we would like to take for the child. And like Megan said, the court does retain jurisdiction, which jurisdiction means that the court does, if the case comes back in, then it'll go to our court. So in cases of permanent guardianship, the court closes out supervision, and supervision is the case management aspect of it, and sometimes the guardian aspect of it. So for adoption cases, and they close out jurisdiction and supervision. For reunification cases, they might close out supervision but retain jurisdiction. But for permanent guardianship cases, they close out supervision and retain jurisdiction over the case, just in case that parent does come back. That same court has the control over that case, so it will go back to that case for the purposes of reunification if they choose to reopen the case.
And then we have adoption. So a permanency goal of adoption means that we could still be in the TPR process, or we could be post TPR and working on adoption. So once the goal is changed to adoption, a TPR petition is typically filed. We have the advisory, either the parents sign surrenders or they take it to trial, and then trial happens. You may have to testify. If the judge grants termination of parental rights and we have a final order, then an adoption worker will be assigned. They'll begin a home study. So I know a lot of caregivers are like, oh, I have to do another home study. I have to fill out this huge packet. It's just part of the adoption process. If the caregivers have any history with the department, if they have any criminal history or anything concerning on their background, they will go to the adoption review committee, where they will sit in front of a panel of people from DCF, BFP, Family Allies, and the Guardian Ad Litem program, and they'll explain what happened in their past and why it happened, depending on the severity of why they had to go to the adoption review committee. They could have tasks that they need to do, or the committee could just hear what they have to say and then decide that they're ready to adopt. Anything else?
So the adoption agency that we work with, they're called Empower, and they are actually housed in the Rockledge building. And there's a team of, I think, 4 of them that do adoption home studies, because they are called adoption support coordinators, I believe. And so what happens is, so TPR occurs for 2 reasons. So either, like we spoke about before, the abuse was so egregious that we go expedited TPR to where that parent is not going to be offered a case plan and the advisory will be set and we're going to move forward that way. Or if the parent has not completed their case plan to the reasonable level to where they can be reunified, then the department will file, or the GAL could file a termination of parental rights petition after those parents. So like Megan mentioned about the ARC, so there are certain circumstances where the caregivers will have to get re-fingerprinted, and there are certain background criminal history things that may statutorily exclude a person from adopting a child. Like I have a case now where the caregiver has some criminal history, and he was fingerprinted last year, and the fingerprints came back that as an automatic disqualifier. So he was re-fingerprinted recently, and luckily there was not a disqualifier on there again, but that case will have to go to the adoption review committee because of his history. And then, like Megan talked about, if they have to do like tasks or anything, if we're not yet post TPR, but we have issues going on, like whether they be substance abuse issues for the caregiver or anything else like that, I would try to bring those to light as soon as possible. That way, if we can get the services in place before we get to the ARC point, then the ARC can take that into review. Like Megan and I have a case where a household member was just released from jail and he has a substance abuse history. So I've spoken with the caregiver about random drug screens and getting him in outpatient treatment. That way, when we go to ARC, which we will have to due to his criminal history, they can look at that and see that he has taken efforts to better himself for the children, because we don't want to get to the point where we're delaying permanency for the kids because the caregiver hasn't done what they need to do to move the case forward.
So moving on, there were some questions that were submitted prior to this training. There were a lot about how to best help DCMs. I know that as a DCM, the ongoing communication really helped me. We bounced ideas off of each other. Sometimes the joint visits were helpful because I was able to show somebody else what I was saying to the child or to the caregiver. Zharia, what else do you think?
Just going off of that, I would say the ongoing communication is very, very important. I'm not sure if you guys know Pam Langford. We had a case together, and Pam and I would talk multiple times a week about the case. Both of us did multiple joint visits to the home. We collaborated very well, and then we got the outcome we wanted. But just the ongoing communication. Some of the other questions were about like the same issue that we have of the GALs not being informed of when meetings are occurring, or if they are already occurring. We talk about how just to reach out to that DCM, then wait the 2 days, and if nothing on that, add your CAM on the email. That way we can cross any barriers that we might have. One of the other questions was tips or tricks. I'm not sure if we mentioned it, but oh yes, we did. Talked about like helping us. School, if you call the school and get records from IEP, that helps me out. I would say maybe reach out to the DCM you're working with and see if there's any records or anything that they may need help with, or if there's anything at all they need help with that you'd be able to help out with, because you don't know unless you ask. And then hopefully that GAL will be very open and able to and be willing to work with you so you guys can work collaboratively together. We talked about introductions.
Somebody asked if it's the parent's responsibility to contact the DCM for services, or is it the DCM responsible to reach out to them? So the answer is both. The DCM is responsible for doing referrals and giving the parent the contact information for the providers, but it is the parent's responsibility to be talking to the case manager and telling them what the barriers are. So for example, if they're assigned to Aspire and they've tried calling Aspire's not answering, they haven't heard from Aspire, they need to be telling their case manager that, because if not, the case manager won't know. And they're also in the case plan, I believe, it is ordered that they need to be contacting their DCM at least every 14 days.
Yes, and then on the opposite of that, you'll have parents who will say, I haven't heard from Aspire, but we have the ability to go in Mindshare and see Aspire has tried to contact you on multiple dates, and you can get back to that parent and say, hey, although you said this, the provider reports indicate that you haven't done anything, so please reach out to them, which I will say I'm a big proponent of doing things over text messages, because if you do it on phone calls, parents will say, I never heard that. So if you text them, you have the dates, the times of all your efforts to engage that parent, and that's also great for reaching out to DCMs and FSWs and DCM supervisors, because if you try to reach out to the FSW multiple times to see when and where they visit and the FSW isn't responding, you've made your efforts at the GAL to try to go to that visitation. Same with the DCM. If you've tried to ask the DCM multiple questions on text message, email, no response, you have that record in your log of your efforts to try to work with that DCM to get the information that you need.
And Zharia, what are some things that DCMs wish GALs would do that they aren't doing, or maybe don't know that they should be doing?
So I would say this applies to both DCMs and GALs, just a redundant ongoing communication. So I have kind of told myself that from now on, I'm going to try to at least touch base with my DCMs, GALs that I don't talk to regularly, at least once a month, if not more. That way we are on the same front. And then I will say, I would like the GALs to maybe reach out more to DCMs about doing joint visitations. I don't know if any of that occur unless there's an issue going on, but an issue doesn't have to be occurring for you guys to want to do a joint visit. And if there is an issue with the DCM, wanting you guys to come, I feel like that should be spoken about with somebody higher up, because it shouldn't be an issue if a GAL wants to come to a home visit with that DCM.
We have a question that says, when a GAL has a question, for example, regarding a case plan, should they get in touch with the DCM directly or the CAM? So I would say you could always reach out to your CAM first. They may be able to answer your question pretty easily. If not, you can always reach out to the DCM. That's part of having that open line of communication. And if you ask them questions, you shouldn't be like, it shouldn't be a bother to them.
Yes.
We're here to openly communicate. So you could ask both. I would recommend going to your CAM first though, just because we may be able to answer it quickly. I know typically for my volunteers, especially if you text me, I'm answering pretty much like that.
And I would say because the DCM should be the point of contact for everything on that case. Whether it be parents, schools, medical, dental, that DCM should be able to answer every single one of your questions. So I feel like if you have a question on their case plan compliance, visitation, that DCM should know. So I would say, and then like Megan said, you should have that open communication to where you guys feel comfortable to reach out to them. If you don't, like you said, you can always reach out to your CAM. I love all of my CAMs that I work with. So even if you don't feel comfortable reaching out to me, I have no issue with the CAM being like, hey, what's going on with mom's case plan? Because I'll respond just as if I was talking to that volunteer.
We were asked, what is the best way to get a DCM's JRSSR prior to the hearing? We do get those and we put them in Optima. Unfortunately, they're not always filed 2 weeks before the hearing, whether it be the DCM's overwhelmed and is trying their best to get their reports in, or sometimes they have administrative issues where they sent in the report 3 weeks ago and it's not filed until the day of. So
Yes.
if you don't have it, you can reach out to the DCM. And that leads into another question where it says, how are we supposed to get progress details for the case plan before we prepare the JR report? Email or text or call your DCM.
Because like I said before, they should know. I can give you the rundown on every single one of my cases from beginning to where we are now, to case plan compliance, to visitation, because that DCM should be the point of contact for all aspects on the case. If you have any issue getting that information out of them, reach out to their supervisor, because if they don't know, their supervisor might. And please don't feel discouraged if you have to email me, text me, call me multiple times. I mean, while you guys have a job to do, so do we. And I feel like I don't want me not responding to you to affect your timeliness of your reports getting in, or the information in your reports to be accurate. So I would say a phone call should be, or phone call, email, or text to get an update is what you should have, because that DCM should be able to give you the ins and outs on everything currently going on in that case when you reach out to them.
That will also prevent you from giving information that may not necessarily be up to date or true. We were asked, can we move from conference calls to Zoom, Microsoft Teams, or some type of video conferencing? A lot is lost with no visual communication. This will also cut down on side conversations and talk over. So we can't necessarily control what staffings do. We can ask, again, upper management and see if there is a way, because you're right. When we're talking on the phone, we don't see nonverbal cues and we don't see body language. So that's something that case management and the GAL program can work on collaboratively to try to get figured out and see if maybe we can benefit. But if anything, if you need to FaceTime with your DCM, I'm sure they'd be like, okay, let me get it in the schedule and you guys can talk that way.
Yes, and then some of them are more open to doing in-person stuff than others. So if we're working in the field, we just have to wear a mask. But I have no issue meeting with a CAM, a GAL in person, at a home visit, out in public somewhere, wherever you guys want to meet. But for that, it also does depend on the DCM, because some DCMs, given the current pandemic, probably aren't going to be comfortable with meeting in person. And for the staffings, I would say it's generally up to whoever the facilitator is. But on a personal level, myself speaking only, I have no issue with FaceTiming, Zoom, GoToMeeting, whatever platform that GAL or CAM wants to speak on. I have no issue with it. So I would say for that one, it's at least a DCM specific thing.
And we touched on how to ensure team members are all included. Again, that's another thing that we can work on together to try to make better. And I think if all parties are aware, we can definitely work on trying to make it a better situation for everyone. Because I know personally it's very frustrating when I'm sitting on the phone waiting for a staffing for 30 minutes and it never happens. Mm-hmm. And I know it's frustrating for the volunteers too. It's frustrating for DCMs. It's frustrating for all parties, because we all do have time that we could be doing something else, and that's not being respectful for everyone's time.
And then another point, please feel free for you guys to reach out to your caregivers if you guys have been told a meeting is canceled or rescheduled, because we may not have told that caregiver already. I won't feel any type of way if you do, because it's helping me out with less thing I have to do. Because there's certain instances where meetings are canceled and I'm in 50 different places and I don't remember to tell that caregiver. So if you guys remember, by all means, please reach out to them and let them know of any upcoming meetings. I also have no issue with GAL telling or reminding the caregivers of upcoming court dates or any other important meetings or staffing regarding the case.
And then we had several questions asking what the best way to work together is and how to keep communication going when we're on separate pages, and what to do when we are on separate pages about the next step. So my advice would be, first, you should be staffing this with your team. So your CAM, your attorneys, they may have a different point of view than you do, and they may be able to inform you on what point of view they have and why. There's also external staffings that we could have with your DCM, or you could just be talking to your DCM in general. That ongoing conversation is really going to help keep things from becoming extreme and hostile.
Yes.
And respecting boundaries as well, and respecting people's time. So again, waiting maybe that 2 days could keep you from getting frustrated because they're not responding right away. Or I know sometimes people don't always put on their voicemail for when they're on vacation, or their email. So you're like, why isn't this person responding to me? They may be on vacation. That's when we can start rising above and going to the supervisor and everything. But communication, communication, communication.
And going off of the boundaries, I would just keep in mind to be professional at all times. That not only goes for case management, but also GAL program, because I've seen lots of cases where, whether it be a text message, an email, or a phone call, where one or both sides of the situation are not acting as professional as they should be. And that's just because maybe due to lack of ongoing communication, it has also boiled over to a point where people have forgotten that we're all professionals here. So I would say keep that in the back of your mind moving forward, not only with us, but also the caregivers and the children.
I agree. It's very important to stay professional. I know at the end of the day, not everybody is going to work well with everybody. You may have a case manager who you have two very strong personalities and you just clash and you don't work well together. That's okay. We're lucky as Guardian Ad Litem's, well, at least the volunteers are, you get to choose what cases you work. If you are picking a case and you find out that it has a case manager who you just don't work well with for whatever reason, avoid that case. But do your best to remain professional, and if for whatever reason you're trying, and the other person just isn't giving, then at that point we can resort to other options. But we do want to show that we're trying and that we're being professional, and that no matter what, we're not saying inappropriate things to the caregivers or the children about the other party.
And that goes for us also as DCMs, to make sure that we're not being unprofessional with the GALs, the CAMs, the caregivers, the parents, or the children, just to maintain that kind of in the forefront of your brain regarding the professionalism.
And I think that's it. Are there any other questions? Oh, I see, Deanna. You're muted.
Zharia and Megan, I applaud you. This was a great training, so informative, lots of great practice pointers, and something that we can use for trainings down the road for new guardians and hopefully new DCMs coming in, so we can continue to work well together and learn from each other. Lots of accolades from all the attendees on the great information that both of you shared. Can't thank you enough. And I would like to do our spin the wheel, guys. So just give me a moment. I'm trying to bring that screen up.
And thank you to everyone for attending.
Yes, and then thank you to Dina for having us as panelists on this. We were both very, very excited to do this and very, very appreciative.
My pleasure. It's been great working with both of you.
I would agree.
Okay, so I'm going to spin the wheel and we'll see who the winner of our $25 or is it $35? I don't remember how much, but in any event, the winner of our gift card is.
So exciting.
Who's the winner?
Woo!
Amy,
Richard.
congratulations. We'll send that to you in the mail. And just as Megan and Zharia said, thank you so much for attending. And I'm so sorry that this went over our expected time, but the information was so great. I didn't have the heart to stop at 1 o'clock. So if anyone that you know had to get off for whatever reason, just let me know and I'll send them the recorded training video. Thanks so much, everyone, and reach out with any follow-up questions. Enjoy the rest of your afternoon.
Well, thank you guys so much.
I don't know.
Okay, you hit the X mark and then you can hit leave webinar.